Hi all, I'm Dincy here back with MSN in Genitourinary system, and the topic is nephritis. Nephritis, simple, it's an infection, inflammation of the kidney. As we know, the basic unit of kidneys are nephrons, right? So, this is a very dangerous disease. Once it is not treated in the initial state, it can lead to death also. What happened exactly is like once the neurons are getting, sorry, not neurons, nephrons are getting inflamed, the glomerular gets affected, glomerular membrane gets affected, and that is ending up in oliguria and uremia. Oliguria we had discussed last topic. Uremia is a retention of waste product, which is an emergency condition, and that we'll be discussing in the coming on classes. Okay, so nephritis are two types, that is acute nephritis and chronic nephritis. Acute nephritis is a cause due to the allergy. Okay, we can say it as hypersensitivity due to drug therapy, as analgesics allergy, or due to any anti-cancer drugs. Okay, because of that acute nephritis occurs. Chronic nephritis is due to recurrent of acute episode, and also with increased BP. Okay, then autoimmunity, obstruction of urinary tract, autoimmunity, self-attacking, and there is an obstruction in the urinary tract. This all can cause a chronic nephritis. Okay, so etiology and risk factors is, first one is pyelonephritis. I hope you all remember pyelonephritis, or else go back to the video and check it once again. Okay, then autoimmune disorder, weak immunity, okay, because of cancer and HIV, rheumatic fever, okay, then prolonged throat infection, okay, then use of painkiller, excessive alcoholism, and decreased BP. These all are the etiology that can lead to nephritis. Moving on to the pathophysiology, due to etiological factor, okay, there will be a throat infection because of the streptococcal bacteria. This is also a bacterial infection. So, streptococcal bacteria, throat infection, that can have, see, once an antigen is coming in our body, there will be an antigen antibody reaction, right? The same way, here also antigen antibody reaction occurs. Because of that, it affects the glomeruli by thickening the cells of the glomerular membrane, okay, which is ending up in scarring, and later on decreased GFR is glomerular filtration rate, ending up in signs and symptoms. I hope pathophysiology is clear. I repeat it, due to etiological factor, throat infection, which can lead to antigen antibody reaction, ending up in glomerular membrane thickening, which is because of scarring and fibrosis, decreased GFR, and signs and symptoms. Okay, signs and symptoms: swelling of the tissue, thickening, swelling. Okay, then malaise, tiredness will be there, cloudy urine will be there, uremia we will discuss. Okay, then pus and urine, hematuria, dysuria, there will be excessive weight gain, loss of appetite, but weight gain. Yes, because of this condition, you will be, hormone secretion will be there. Because of that, you will be gaining weight, but your loss of appetite will be present. Okay, vomiting will be there, albumin will be present, and even the joint pains and all, abdominal and joint pains will be there. Okay, these are the clinical manifestation. Moving on to the diagnostic evaluation, history collection, physical examination will be there, blood test will be doing, KFT and CBC. Okay, then kidney biopsy, ultrasound, as well as X-ray will be done. Abdominal pelvic X-ray will be done. Moving on to the management. Medical management usually will be doing symptomatic treatment. Okay, pharmacological management, antibiotics can be given as it is a streptococcal bacterial infection. Okay, then even chronic pyelonephritis is there. So pyelonephritic management will be given, corticosteroids, antihypertensive drug. Okay, then dialysis also will be done if it is not treated. In the first stage, if we are not able to do anything, then we will be moving on to dialysis. Okay, dialysis is a very important in this system, so we will be discussing in detail about it. Okay, so this was all about nephritis. I repeat, what is nephritis? Nephritis is an infection, inflammation of the kidney, and if it is not treated in the initial state, it can occur death also. due to the infection, destruction of the glomerular membrane, which is ending up in oliguria and uremia. There are two types of nephritis, that is acute and chronic. Acute due to hypersensitivity of drug therapy. For example, due to depression, we give lithium carbamazepine and all. Because of that, the person is having allergy also. I just said an example, okay. Then chronic nephritis, okay, because of the recurrent acute episode as well as increased BP, autoimmune obstruction of the urinary tract. Moving on to the clinical manifestation, hematuria, pyuria will be present. Oh, I'm sorry, not a clinical manifestation. Etiology, pyelonephritis, rheumatic fever, decreased BP, okay, prolonged throat infection, low immunity due to cancer and HIV. Pathophysiology due to etiological factor, throat infection, antigen antibody reaction because of that, thickening of the glomerular membrane, which is ending up in scarring, and decreased GFR, which ending up in signs and symptoms. Signs and symptoms are dysuria, pyuria, okay, weight gain, loss of weight, mouth ulcer, vomiting, increased BP and all, okay. And diagnostic evaluation mainly will be focusing on kidney biopsy, blood test, KFT, okay. Then management, symptomatic treatment as well as antibiotics, antihypertensive drugs to reduce BP, corticosteroids, okay. Then dialysis will be done to control the symptoms. If it is a moving on to the next stages, it's not in the initial stage, if next stage, then to save the patient we will be doing dialysis. I hope you all understood this unit, and if there is any doubt, please get back to me. Thank you. Have a nice day.